Okay, Rick, here we are together. I'm so glad to be welcoming you to be speaking for the IMHU audience.
Well, thank you for inviting me. I'm glad to be here too.
You're very welcome. Maybe you could start by just telling us where you work and what kind of work you're involved with right now, because you've done many things in your career.
Well, I'm a psychiatrist by training, and I worked at Spaulding Rehabilitation Hospital in Boston for over 20 years in their pain management program. And there are several unique features of that that really play into what your university is gearing towards. Part of it is that it's a team orientation. So I've worked with physical therapists, occupational therapists, nurses, as well as pain doctors to cover all the parts of the person, not just the body itself. Mm. And then also, because of the nature of chronic pain, that mainstream medicine doesn't always have the final answer. So there's a lot of openness to try alternative approaches. So we've had an opportunity over the last 20 plus years to bring in a wide range of energy-based and consciousness-based approaches that I hope I'll be talking about in the next few minutes.
Wonderful. So where you work now, though, is a little bit different than where you have worked. Do you want to say where that's located so people can put you on a map, as it were?
Right. The main hospital, actually, the main hospital in Boston where I used to work, has been relocated, and a new structure was built just a few months ago in Charlestown, Massachusetts, which many people in the country have found out about because, oddly enough or coincidentally, the victims of the Boston Marathon bombing eventually ended up at Spaulding being treated there, and it got national publicity. So it was a new hospital treating these highly unusual circumstances of patients. So that's where I used to be. Right now I'm at one of the satellite clinics in a suburb town called Medford, Massachusetts, and that's where I've been.
Right next to Tufts.
It is, yes. Right. Tufts University is in Medford.
Great. And are you also teaching right now as well as working as a psychiatrist?
Well, the teaching sort of is part of the clinic operation because our hospital is affiliated with Harvard Medical School, and their residency program in physical medicine or rehab medicine is based at our hospital. So their residents rotate through our clinic. We'll do a month-long rotation in chronic pain management. And so I have exposure to them. They can sit in on some of the behavioral groups that I run, just chat at lunch, things like that. So it's not formal lectures, but it's sort of the hands-on type
supervisory kind of role that you're playing? Okay.
Right.
And then you also, I think, have written in the realm of alternative and complementary medicine and transpersonal hypnotherapy. Maybe you could say a word or two about what you've written and also this film that you've recently come out with.
Well, the first sort of legitimate alternative approach that I worked with was hypnosis. And there's a national organization, and people are credentialed, and there's a certain aura to it, but I found a nice niche there and began to hear about people who worked with unusual applications of it, everything from remembering early childhood events to, birth trauma to pre-birth events. And so the whole realm of transpersonal hypnosis kind of came together. And there were 6 or 8 other members of the national organization who were interested in this, and we put together a book about, I don't even remember. It's probably about 15 years now that we put it together. Okay. And so that's one way of using attention and focus to access different realms. Yes. I'm not doing that kind of work clinically now, but at the hospital we've organized what's called the Integrative Medicine Task Force. Integrative medicine is the new official term for alternative or holistic or complementary medicine, and I think it's going to stay. People are just tired of changing terms every 5 years.
Yes.
So we have an active group that started actually in our Medford clinic and has spread to the main hospital, and now we even have a network-wide one because the business of healthcare, it's a corporate takeover model, and so there are a lot of hospitals now that are part of our network and a lot of clinics that are part of our network, and we're trying to coordinate this integrative effort, and it's actually coming along really, really nicely.
So you're taking collaboration to a whole other level.
Yeah, it's not the one I'm used to.
That's fabulous.
Between institutions and
Yeah.
across geography, but that's how it is.
So let's stop there for your intro, and we'll go further into detail in the next part. Okay?
Okay,
Thanks
good.
so much for being with us.
You're
Goodbye
very
for now.
welcome.